just a little bit past 3:30 on Thursday, May 14th, 2020. Thank you for joining us. This is Janet Hill at the Rock Island County Health Department. Today we will be hearing from Nita Ludwig and Ed Rivers, and we also have two members of the faith community to talk about what their communities are doing in the time of coronavirus. After prepared statements from each of our speakers, we will take questions. We ask that you direct your question to the person you want the answer from into the chat box, and Brooke Barnes of the Scott County Health Department will moderate the Q&A section. Nita, please start us off with today's case count in Rock Island County.
Well, thank you. Unfortunately, today we are reporting one death, and that brings our total number of deaths in Rock Island County to 19. And we are certainly sad to lose yet another member of our community to this virus. We urge the public to keep doing what they're doing and observe the governor's stay-at-home order and wash your hands frequently to protect these most vulnerable people. This person that passed today was a woman in her 90s. In addition to that, we are reporting 3 new cases of COVID-19, all of whom are isolating at home. This brings the Rock Island County total number of cases to 598 cases, and 11 patients are currently hospitalized.
In Scott County, we're reporting 2 new cases for a total of 293. Our deaths remain at 8. One of the most noticeable closures for many in our community has been restaurant dining. Tomorrow, restaurants and other businesses will be allowed to reopen with a number of protective measures in place. We'd like to explain the requirements restaurants will be implementing to ensure the health and safety of patrons and workers. If you visit a restaurant in upcoming days, things may look a little different. Restaurants are required to limit indoor and outdoor seating capacity to 50% of the normal operating capacity. As we discussed yesterday, an interpretation issued by the Iowa Department of Inspections and Appeals indicates that outdoor seating cannot be used to increase the seating of a restaurant above the 50% of rated capacity restriction. Indoor and outdoor seating as a total must not exceed 50% of the establishment rated capacity. They must also limit group sizes to no more than 6 people. Arrange seating to provide a minimum of 6 feet between tables. Not allow customer self-service of food or beverages, including buffets and salad bars, and implement ways to ensure physical distancing of employees and customers and increased hygiene practices to help reduce the risk of spread of COVID-19. While restaurants are required to have these measures in place, they will also rely on you to do your part by following these new requirements. And just a word about Test Iowa. As we mentioned, Test Iowa site is currently operating in Davenport. All residents are encouraged to complete an assessment at www.testiowa.com. If you've already completed the assessment, but something has changed, you're encouraged to retake the assessment. The site also has frequently asked questions page to answer any questions you might have. Back to you, Brooke.
Thank you, Ed. Next, we'll hear from Nita Ludwig with Rock Island County Health Department.
So we have been watching our COVID-19 case counts here in Rock Island County with a watchful eye this week. Today, we reported 3 new infections. Yesterday, it was 5, and Tuesday, it was 3. These numbers are a far cry from our daily count when it topped 20 every day. Is this beginning of a trend? It's too early to tell, but we can say that our main tools are working. Please keep staying at home as much as possible, and especially if you're sick. Keep at least 6 feet between you and anyone else. Wash your hands frequently with soap and water for at least 20 seconds, or use hand sanitizer. And cover coughs and sneezes with a tissue or your elbow, and wear a face covering when you must go out for those essential supplies. We're hopeful that we have turned the corner because of the efforts you have all made. Earlier this week, Governor J.B. Pritzker shared metrics that show our region is on track to move to phase 3 at the end of May. Phase 3 means employees from non-essential businesses can return to work, stores and gyms can open with capacity limits, and salons and barbershops can open with some restrictions. Illinoisans are reminded that we are still under the governor's stay-at-home order until at least May 30th. Please remember that when you consider going to Iowa, we don't want to go backward on all the progress we've made. Thank you.
Thank you, Ed and Nita. Next, we have invited 2 additional members from our local faith communities to discuss how faith communities have handled services and other faith activities in response to COVID-19 and their plans moving forward. First, we will hear from Reverend Melvin Grimes with Churches United. Please go ahead, Pastor.
All right, thank you. And hello to everybody. Churches United has been at the forefront of trying to cope with the changes that normally affect our ministry as far as our feeding is concerned and as far as our shelter is concerned. We now have our total number of cases as far as feeding is concerned has gone to 55, and it is split up between us and Adventure Church in Davenport, who takes care of those who have been displaced from both Humility of Mary and King's Harvest. We also continue to provide meals for those who seem to be missed in or were not in shelter that are on the streets, and we will continue this operation until the end of May, and then we'll assess where we're at. As far as worship is concerned, and I kind of double as both a pastor as well as executive director, in talking with our faith leadership today in our meeting in Bettendorf, most churches are still on track to not really reopen to face-to-face worship services until sometime in June. The reason being is we are in the process of putting together plans on how we are going to then have formal worship services. There are going to be several restrictions. Also, as we're looking at the picture, there are going to be requirements of training for our staff, as well as what we're going to do as far as those members who are still vulnerable and have compromised immune systems. At our church in Moline, I don't look for us to return to face-to-face worship until probably mid-June. Until then, we will continue to live stream our worship services as well as our Bible studies. And so this has been a difficult time, as well as trying to ease the concerns and fears of those who are becoming, number one, frustrated because they got to stay at home. Number two, wondering because we're moving through uncertain times and at this time. So that's where we're at as far as Churches United, and also from the standpoint of my own church that I pastor.
Thank you very much for sharing that with us. Next, we have Lisa Killinger with the Muslim community of the Quad Cities. Please go ahead, Lisa.
Good afternoon. Thank you for inviting me, and we'll greet you as the way Muslims greet each other. May the peace of God be with you. We have just passed the midpoint of our holy month of Ramadan, in which Muslims fast around the world. We fast from sunup to sundown for the past 3 weeks and have about 10 days remaining of our fast. We traditionally gather together and have fast-breaking meals with our congregants and congregational prayers that may include up to 200 people in our local mosques. But needless to say, that is not happening. We are not open at the mosque at all. So Ramadan is our most connected time physically and spiritually with our community, but then came COVID-19. So while we miss that physical closeness with our faith community members, we believe that with every hardship, there's an opportunity to draw closer to God. So Ramadan 2020 will long be remembered as the year that the world got the opportunity to draw nearer to God through quiet solitude and contemplation, which is what we're doing in the Muslim community. The word Islam means the state of being at peace through submission to God, and Ramadan certainly will be, during this COVID-19 pandemic, is undoubtedly going to be known as the Ramadan of peace. And our Holy Quran states that whoever saves a single life, it's as if they saved all of humanity. And Islam has a rich history of scientific discovery to try to help humankind and to save lives. The roots of modern chemistry, epidemiology, anatomy, the concept of hospitals and libraries all began with Islam and were born of Islamic guidance and an appreciation for scholarly work. So over 1,450 years ago, Muslim scholars encouraged that anyone who is sick should be in quarantine and banned travel or restricted travel to areas, in and out of areas where there was an outbreak or where disease outbreaks were occurring. There's certainly much that we can apply in that to COVID-19. In this pandemic, science can and should be the guiding, as much of a guiding light as faith. And we encourage faith and civic leaders to look to the experts in the fields of public health, immunology, and epidemiology for evidence-based guidance on keeping our communities safe, and certainly in the process of reopening communities, which our Muslim community will be doing in the weeks to come. We're making our plans, and like Pastor Grimes said, it should be mid-June or later when we come back to face-to-face gatherings. We pray for the Quad City community to draw nearer to God and their families, to find peace in these opportunities that the pandemic has provided. And as well, let's this month look inward to find ways to share love, faith, and support of those in need in our community, whether that need is for comfort, for food, for shelter, or simply a prayer. And the Muslim community, like Reverend Grimes mentioned, is deeply involved in the Humility of Mary, feeding those who, preparing meals for about 100 and some individuals who are displaced every day. And it's really, really a great effort that's occurring in between our faiths in the community. So let us strive, in all of us, to be helpful in some way during this uniquely challenging time. Thank you.
Thank you very much, Lisa. We will now go to the chat. We've had a couple of questions. Please type any additional questions into the chat, and we will have Ed and Nita join us again. For the first question, it says, for Ed and Nita, what role will health departments play if their respective states run out of hospital beds or ventilators? Do you want to start with that, Nita?
Sure, I will take that one first. I am going to put a link in the chat box too, and this is to the Governor's Restore Illinois plan. And there's a dashboard there to that link that says basically we are in very good shape with hospital beds and ventilators, and we're all on track to move to phase 3, as I mentioned earlier. But if we were to need ventilators or other bed capacity, then public health would work with the Illinois Emergency Management Agency. We have our local emergency management agency here, and the director of that would run requests for supplies or other needs to the Illinois Emergency Management Agency, which then goes up to the governor's office.
Well, in
Go ahead,
Iowa,
Ed, would you like to?
Sure. In Iowa, the local health departments don't play a direct role in such matters, as hospitals are required to report their numbers of beds and ventilators to the state health department and the emergency operations center, and the regional medical coordination centers are in charge of handling those issues should they arise. However, locally, we have collaborated with our emergency management agency and our medical facilities to gain an understanding of what their situation is with respect to beds and ventilators. And they have it well under control. One of our medical facilities indicated that at their highest census, they approached only a small fraction of their surge capacity with respect to ventilators and hospital beds. So we believe locally we're well positioned to handle any conceivable surge.
Thank you. Next question is for Pastor Grimes. Can you tell us what the 55 refers to? Was that people or pantry sites?
No, it refers to 55 people who were part of the numbers that were displaced at Humility of Mary and King's Harvest Shelter. Our pantries, with the exception of 2, continue to operate on a limited basis. Our pantry coordinators have set up the details for going into on how they serve their clients. And so we continue to move at a pretty good pace with that. We also have a gentleman who is in a mobile unit that goes around and gets to people who they cannot get, that they cannot reach or cannot get to local food pantries. So we are still continuing to do that. We serve and we're feeding in cooperation with other churches. We serve a capacity of approximately 220 people between the 2 cities of Bettendorf and Davenport.
Thank you very much. Nita, one additional question for you. Do you have any updates on Tyson-related cases?
I do. So as of this morning, there are 115 confirmed Rock Island County residents who have tested positive that work at Tyson and Joslin, and that does equal about 4% of their entire workforce at Tyson.
Thank you. Seeing no additional questions, we will be concluding the briefing for today. Thank you to the partners who joined Ed and Nita today. So Lisa and Pastor Grimes, we appreciate you being on, and we appreciate the media for joining us to hear some of this important information. And we do not have another briefing scheduled until Monday. So any updates on numbers will either be shared by Rock Island County Health Department daily. Additional information for Iowa can be found at coronavirus.iowa.gov. So thank you all. Have a good afternoon and a nice weekend.
Thank you.
I know.